Family health service through home visit. The community health nurse has an important role in family health care through home visits. This is a part of the family health service that focuses on the family as a unit of care. Its goal is to achieve well-being and provide health services to all family members, including health promotion, disease prevention, and minimization of health risks, primary medical care, and rehabilitation to a normal condition. In this regard, the community health nurse must apply the family health nursing process to family assessment, nursing diagnosis, nursing planning, nursing implementation, and evaluation in order to provide family health services. Family health care provides services to families with members in normal health and families with members who are at risk for health problems such as postpartum mothers and newborn infants, preschoolers, teenagers, middle-aged, adult, and elderly persons. Moreover, it includes the family whose members have health problems or require special care, such as those with chronic illnesses, communicable diseases, or those in the recovery period. To provide continuous quality health care for the family, family visits are prioritized based on the urgency and prevention of disease transmission. There are 3 steps of family health services through home visits. These are preparation before providing family health service, providing family health service, and after providing family health service. Practices before providing family health services. The community health nurse should study the family history and clients in detail. In the case of new families or home visit for the first time, the study should cover the interview form on general information of the family, online assessment form of chronic diseases, and house map. In case of an old family or previously visited family, the nurse should thoroughly study previous home visit reports in order to facilitate the planning for further assistance or to provide proper advice and counseling. An appointment with the client and their family members should be made in order to do a self-introduction, inform them of the objectives of the visit, and determine the date and time for such home visit. The community health nurse should plan for family health services and activities while searching for knowledge on diseases and proper practices for patients from textbooks, journals, and research papers for preparation to provide services to the family. He or she should also prepare any equipment or instruments before the home visit. These include a home visiting bag, weight scale, health assessment form, recording form, and teaching media. In case of a family whose members include a child, Denver 2 and other necessary instruments should be prepared. The essential equipment and items in the bag include alcohol gel for hand cleansing, cotton gauze, alcohol cotton pad, dressing set, bandage, plaster, thermometer, blood pressure monitor or sphygmomanometer, stethoscope, waist measuring tape, flashlight, wooden tongue depressor, reflex hammer, wound healing solution, saline solution for wounds, 70% alcohol, rubber matting, and plastic bags for contaminated waste. Planning for use of the equipment and items in the bag is needed to suit the family subject to such home visit. Equipment preparation should comply with the principle of cleanliness. The community health nurse must be dressed in compliance with the specified uniforms. Long hair must be properly tied. Any kind of jewelry is not allowed except a watch. Only black trousers and black or brown closed-toed shoes are allowed. A name tag representing the institution should be worn. Practices while providing family health services. Building a relationship starts with introducing yourself, your institution, and the purpose of the home visit. Meanwhile, the community health nurse as a guest should behave politely and respect the family members. In addition, the community health nurse should observe the living conditions, environment, traditions, and relationships of the family members while inquiring in general about illnesses of family members, health care, and other related beliefs about their health care. Services should be rendered in a friendly manner. At the same time, respecting individuality and listening to information given by family members is necessary. All the information should be considered confidential. It is essential to apply various theories for family assessment. These include the system theory, which focuses on the relationships between spouses, parents, children, siblings, and other systems. The structural functional theory includes role structure, value systems, communication processes, and power structure. For family functions, it includes affection and care within the family, socialization function, reproduction function, economic function, and healthcare function. Another is the family development theory, which covers family developmental stages and analyzes family developmental tasks in each stage. Upon permission being granted for basic health assessment, community health nurses will start with weighing, measuring height, calculating the body mass index or BMI, assessing vital signs such as temperature, blood pressure, pulse, respiration, and performing a physical examination. The home visit bag should be placed in an area that is clean and allows the community health nurse to take the items out of the bag easily. The selected area must have enough space for nursing equipment and be out of the reach of children and pets. The home visit bag should not be placed on the floor to prevent contamination. Before laying the bag down, put the rubber mat down to prevent contact with dirt. The method of opening the home visiting bag. The nurse uses one hand to hold the bag and the other hand to open the bag. Then, take the rubber mat out and place it on the area where the bag will be placed. Place the bag at one of the corners of the rubber mat and keep the bag straps in neatly. Clean hands with alcohol gel and take out the necessary nursing equipment by considering each client and place them on the rubber mat. The necessary items include a thermometer, blood pressure monitor or sphygmomanometer, stethoscope, waist measuring tape, flashlight, wooden tongue depressor, reflex hammer, 70% alcohol, and cotton balls. Then close the lid. When the equipment has been arranged, the nurse begins providing nursing services to clients, placing used equipment separately from clean equipment. Weigh the client and assess vital signs by measuring temperature, pulse, respiration rate, blood pressure, and recording vital signs. Tell the vital signs result to the client and calculate the body mass index or BMI, including telling the calculation results. Physical examination of body systems. Observe the client's general appearance, assess the head and face, eyes, nose and sinuses, mouth and oral cavity, ears and lymph nodes, neck and trachea, hands and wrists, elbows, shoulders, back and thorax on the back, heart and chest on the front, abdomen, foot and ankle, knee, hip, nervous system, deep tendon reflexes, and spine. Then, assess the mental status and orientation of date, place, time, and tell the clients the results of the examination. Ask the clients and the family questions about healthcare in order to assess their knowledge before giving advice. The nurse should ask questions based on observation and take the right time to ask questions. Do not use questions that make the listener feel distressed or uncomfortable. Give advice by focusing on knowledge of appropriate health care to manage health problems and the needs of clients and families. The use of supplementary media while providing advice helps the client to understand and remember easily and can assist with evaluation. Summarize the home visit results with the family by summarizing problems and advice. Before leaving, plan a future home visit and make an appointment for the next visit. Clean hands with alcohol gel. Clean equipment with cotton balls moistened with alcohol before storing the items in the home visiting bag. Lift the bag onto your lap, fold the rubber mat, and leave the garbage at the client's home. The House Environment Survey. Explore the residents' sanitation inside and outside the house, drinking water, general use water, waste and waste disposal, raising animals, and eliminating manure. Practices after providing family health services. Clean equipment, home visiting bag, and prepare all equipment and items to be ready for the next home visit. Write a note in the home visit report according to the form of the institution, with the record form as follows. Family Health Care Plan Card. The yellow card is used for infants and preschool children aged 0 to 5 years. The white card is used for family members with health problems, the elderly, and pregnant women. General information of members in the household record form. House map. Genogram. Eco map. The relationship between the family and other systems in the community. Household environment record form. In case of visiting family members who are elderly, disabled, or have chronic illnesses, use the record form for elderly, chronic illnesses, disabled. In case of visiting a family member who is a postpartum mother, newborn, infant, and preschooler aged 0 to 5 years, use the record form for pregnancy, birth, and birth history records, the record form for postpartum mothers, the record form for newborns, and the record form for infants and preschool children. In case of visiting a new family, use the new family record form and the summary of family study. In case of visiting an old family, use the record form for an old family visit. Family Health Service record form. The home visit provides continuing care of clients at home by solving family problems together and helps to promote the health of the family members. The nurse plays an important part of a successful home visit, which requires complete preparation and following the steps of the home visit correctly.